Thank you, everybody, for joining. We have a great lineup of startups pitching today. This is the online pitch event for dental startups, investors, advisors. I'm a startup advisor, been in the dental industry for 20 years now, sold a lot of software, launched a lot of products, worked in dental venture capital in the dental industry, and really found the missing piece was really helping startups and companies. So a little bit about dental venture capital. It's really a product of Dr. DDS. Dr. DDS has been around launching products for many years. We help companies from idea to exit. We work mainly in dental, although we're also in the wellness space. We are not a dental venture capital fund, not a broker dealer. And this is a little bit about our process. So it's a 7-step process, taking you from idea all the way through to exit. You know, a lot of people talk about incubators and accelerators. We got a couple of those on the line today. That's a piece of what we do, but for the most part, any of the companies we work with, we help them with their process, but we're coming in midstream in a process. Clients that are in our group currently are Oratray, Sleepobraze, Tooth Pillow, Envodent, Woods, FX, Go Dental AI, Lucident, One Click Referral, and ToothPod. Some of these companies have had tremendous success over a short period of time. What makes a successful 4-minute pitch? If you follow me on LinkedIn and you're a part of my dental venture capital group, we have about 6,000 people in there. I talk a lot about the successful pitch. One of the most important things to me is just being clear and succinct, but also really bringing in the emotions with some sort of story that catches the attention. So quick introduction, moving quickly through some slides, talking about the problem solution. We all know about the market opportunity. We're all in the dental space. So for the most part, less time on that. And then at the end, a call to action. What are you asking for? And so that's the 4-minute pitch in a nutshell. I am very excited about a new team member who just joined us. He's going to be the managing director of Dr. DDS, our dental venture studio, and Richard Peoples. Richard, I'll let you introduce yourself, add a little more commentary to what you're going to be doing here.
Absolutely. We'll keep it brief. Again, excited to be here. My background speaks for itself here, ex-Google employee. I've joined 2 Y Combinator startup school accelerators. Now I play the role of fractional marketing and an AI executive. I've launched a couple of dental software firms and also have a couple of certifications under my belt to help with mostly SaaS. But very excited to be here, and thank you so much. Look forward to connecting with everyone following the event.
Richard, you want to talk just a little bit about the go-to-market tools and strategies that you'll be implementing?
Absolutely. So what's cooking in the oven is a couple of things we refer to as a suite of solutions that we believe will accompany your journey along the way. Things of digital analysis, go-to-market strategy, contact database management, marketing automation, some AI tools that we can take advantage of in startup phase, lead capture, lead nurturing, paid advertising, and analytics and data visualization. These are some of the things we need in order for go-to-market to guarantee to be a success. So very excited to add this to our suite of solutions.
All right. Thank you, Richard. All right. Well, we have a very special first pitch, and this is one that I'm very excited about. I would put this in the, I don't want to overpromise, but when I saw this, I'm like, this is a unicorn. I told my partners, this is a product that has a lot of potential. So there's only been a few companies that have gone through and done a crowdfunding process in dental. And I want to raise the awareness of this because I think it's worked very well for many people, but so much of this is about the support and the support of the industry, other founders and investors. I have personally invested in Oratray, and I've got the founders on the call here. They are going to be our first pitch of the day. So Fernando, with that, I am going to pass it over to you and let you share your presentation, and you've got 10 minutes.
Thank you. Thank you so much, Travis, for that introduction. Thank you all for giving us the opportunity to speak today. We truly appreciate your time. My name is Dr. Martin Feo. Fernando is my partner. I'm a periodontist and a co-founder of Oratray. We are based in Miami, Florida. And today we're thrilled to introduce you to a product we believe will transform the dental industry. It is the first single-use disposable burst pack dental tray. It is designed to prevent and treat multiple oral conditions. It's convenient, it's effective, and very importantly, it is ready to be used at home. Our first product will be a prescription strength fluoride tray that dental professionals can recommend and prescribe based on the individual patient needs. So here's where Oratray shines. There hasn't really been a significant innovation in the delivery of dental treatments in the past 30 years. As you know, current treatments can be messy. They require visits to the dentist and often cause discomfort, gagging, drooling, and so on. With Oratray, we can change that. Our patented burst pack, that's how we call it. Our patented burst pack technology releases fluoride gel directly onto the teeth when the patient bites down. The tray is designed to seal and distribute the gel perfectly to cover the teeth and the gums while preventing any leaks. And what's even better, it's made from environmentally friendly materials. The team, we have a blend of experience in healthcare, oral care, and personal care, with key members having worked at major companies like Procter & Gamble. Our team has spent years refining our product design and go-to-market strategy, and we're confident we have the right people to make this a success. Now let's talk about numbers. The dental fluoride treatment market is valued at $11 billion today. It is projected to grow to $1 billion by 2027. We're starting our launch in 6 key states in the US along the East Coast, chose based on logistics, market potential, and household size. Our SAM is, in these 6 states, is $1.4 billion, and this is just the beginning. We plan to expand Oratray to treat more conditions beyond fluoride treatments, creating even more opportunities. Our target market is vast. There are 60 million hygiene patients annually, representing $1.4 billion opportunity in only the 6 states that we initially plan to launch. We aim to capture, we're very conservative, we plan to capture only 3% of this market, which translates to 1.8 million patients, and that's $43 million in market opportunity. This, we believe, is a low-cost, high-volume product with a gross margin of 60%, making it an attractive proposition for both the dental professionals and the patients. Currently, in-office fluoride treatments yield an average profit of about $19 per fluoride application. But these treatments, like I said earlier, they're messy, they're uncomfortable, they require chair time and the need of a dental professional for the actual application. Our product, our tray, is designed for both in-office, but very important, at-home use, making it far more convenient and accessible. Patients are more likely to accept it, reducing chair time and increasing the revenue opportunities for the practices. Plus, our tray is priced competitively, ensuring it fits into the market, into the current market with the products that do exist. We plan to launch Oratray through a soft opening with dental wholesalers. Most of them are the ones you know, Patterson, among many others, Henry Schein. And again, it will be in the 6 states on the East Coast. After this initial phase, we will expand to direct to consumer, similar to the success of the company Hims, which transforms how prescriptions medications are sold online. This approach will allow us to reach a larger market while continuing to support sales through the dental professionals, of course. A key part of our success will come from our partnerships. We have teamed up with Nottingham Spear. They're one of the top business innovation and product design firms in the US. They have over 1,300 patents under their belt, and they've helped bring iconic products like Swiffer, Purell, you name it. They're just very, very famous. Nottingham Spear has been working closely with us on the design, the commercialization, and the go-to-market strategy. When it comes to competition, there hasn't really been any real innovation in prescription treatments for decades, we believe. Current methods are uncomfortable, wasteful, and that is, we believe they're just not suitable for the home use, which is one of our main targets. Oratray offers a patented solution that addresses all of these pain points. We minimize waste, we ensure precise dosing, and create a more comfortable experience for the patients. It can easily be used at home and, of course, in the dental office, making it a game changer in oral health. We already have 2 granted patents and have filed for international protection. This puts us in a very strong position as we prepare to scale and expand our product offerings beyond fluoride treatments. We're not a fluoride company. We are a delivery method company. As far as fundraising, we are raising $1.2 million through a crowdfunding Reg C with Start Engine. We have a $6 million valuation. This funding will help us move through the final stages of the product development and prepare for our market launch. In closing, Oratray represents a unique and exciting opportunity to disrupt the dental market. Our burst-back tray not only improves the patient care, but also opens doors to new treatment applications, including periodontal care, dry mouth, pain management, wound healing, teeth whitening, and the list goes on. We're excited about the future and eager to partner with new investors as we continue to grow and scale on this venture. There is a short video, about 2.5 minutes. It's in the Start Engine.
Yeah, I put a link to that in the chat for everybody as well.
Thank you so much. I wanted to ask you to share that with everyone. They'll be able to see, a little bit more in details.
All right. Perfect. Thank you guys very much. Excited to see this product take off. So, all right, great. So up next, let's see, we have our special guest on the line, Dallin Ferris from Vibrant IP. Dallin, thanks for joining. You want to share your screen and talk a little bit about how people can monetize their intellectual property?
Yeah, absolutely. So thanks for having me, Travis. And I'll just go ahead and get right to it, try and follow the effective pitches guidance that Travis has given us. While we're not here to pitch, we're here to inform you about, I guess, a service that most people aren't aware of, mostly because we're one of the only folks that have decided to focus on this, burden or need in the market. So, as Oratray mentioned, multiple patents and intellectual property just tends to pile up. Many companies, whether startups or mid-sized companies or even large companies, they have every day an issue of, what do I do with my patents? How do I make more money off of them? What is the advantage to keeping these patents versus letting them go abandoned? And is there any economic value to all this money that I'm spending with the USPTO or internationally? It's not cheap and it requires serious investment. And so obviously, when you make investments as a business owner, you want to recoup some of that investment. So Vibrant IP, we monetize patents. We help folks make deals happen, whether it's through sale of the patents, licensing in certain fields of use, or licensing in general, and even such things as joint development or other monetization methods with your IP. Not just patents, mostly patents, but not just patents. There's trademarks, copyrights, trade secrets, etc., that we can help in expanding the influence of your IP. So we have a fairly wide scope of services as far as this niche goes. We're not a law firm. We're not raising money, as a broker dealer. We're not a venture fund or anything like that. We're simply a group that aids the marketing and negotiations for sourcing deals when it comes to IP. We prefer, and it's always best that the IP is well developed and that there's product behind it, because evidence of use or use of the technology makes it much more likely that it's able to be monetized. However, that being said, we've had deal history everywhere from only applications, patent applications that have been recently filed with the USPTO, and there's crude mock-ups that have been done. We've transacted those all the way to portfolios in the thousands, in multiple countries and jurisdictions. So we do it all, and we look at every portfolio, because ultimately what buyers are looking for is the solution that we're pitching today. And we want to bridge that gap where, most startups or mid-sized companies, when they're looking for their exit, it's a total buyout of their company that has tons of revenue, and you see on Shark Tank all of the, what are your sales, right? And it's a total sales numbers game, multiples game. We're kind of the other approach where we can help with non-dilutive licensing funding and, what is the IP worth, and conducting a evaluation on the IP that gives us kind of a scope of the market and what kind of income might be generated from these patents or other IP. So this is kind of a list of our services, but we're a firm that everything IP is kind of our specialty. So we agree and have kind of a white glove approach to this, similar to how Travis conducts his business, where there's a exclusive club, you might say, that it's to get in and use our team's time, and our team is ever growing and has a depth of experience. I'm obviously the junior of the group, but nonetheless, we all have deal experience and, transactional work or legal background or, business experience in general that is able to help us provide the best service possible for our clients. Some companies that we've transacted with, this kind of gives us a broad array of, who do we speak with and who are we going to talk to? Who have we talked to in the past? We've seen everything from university deals and licenses all the way to hospital systems, med device and pharmaceuticals, to the big tech giants of the world, the data companies and others that are actively investing not just in healthcare and dental, but in all technology areas. So, occasionally when you're developing IP, there's adjacent patents that you accidentally invent but file anyways, or things that were acquired in a merger or in a license from a university that are no longer necessary to the technology, and we can aid with all of that as well in all verticals. These are kind of some sample deal sizes. Everyone's IP is different, and we hesitate to give any case studies that say, here's what could happen if you look like this or like that, because ultimately IP is worth what people are willing to pay for it. However, that's where our negotiation experience comes in handy. We have, per patent figures and per technology or transactable technology and property figures and other history like that gives us a good background in our negotiations. But these are kind of some samples for you to see that our team has handled everything. And, we're doing anything from, engineering and mechanical deals to pharmaceutical and chemical, and everything in between with the software and code and that sort of thing. This is some of the figures. This is an old presentation, I will say. We're at, $4 billion in cash transacted and, nearing 500, if not surpassed 500 closed deals as far as IP goes. So we've seen a deal or two and have been around the block, and there's been, thousands and tens of thousands of patents that have traded with our support. People always ask, Dallin or Vibrant, what do I see? What can I expect? Are you going to go off and sell my patents for $10? What kind of offers can I expect to reasonably see? This kind of gives us a good figure. Typically, if technologies are well developed and our market need, it could be anywhere from 6 to 8 figures, up to 9 figures. We've supported deals on the higher range. We've also supported deals on the lower range. It's worth both of our time to explore that together before starting this process to see if we believe that there's commercial viability. And, it's likely that when you're working with Travis, that's something you've already done. Or when you're working, as a startup, with intellectual property to make any investment to get to that point, you've already done to some extent commercial viability. But we take it a step further and say, what might we be able to get out of this deal? What could it look like? How many licenses could we do? Can we do a license in Europe and a license in the US and a license in China? And, what are the exceptions to that? And, is there IP supporting that? Or, is there commercial need in all of those markets? So these are some of our terms. I think we're fairly similar. We act as an exclusive broker, and this is all, subject to any negotiation, but these are our standard terms that we start out with. And then barring any, extraneous circumstances, we try not to depart from these so that everyone gets equal service. But that's kind of where we're at, as a group. And
I'd get in touch with you guys.
Yeah, so I would say you can find me on LinkedIn, Dallin Ferris. You can search us on Google, Vibrant IP. Even if you search patent broker or medical patent broker or dental patent broker, will come up under those searches. You can find any one of my team members, Spencer Rogers, Peter Johnson, or any others. My email I'll post in the chat along with my LinkedIn.
Just go ahead and put your website in the chat. And all right. Well, thanks, buddy. Appreciate it. Love what you guys are doing.
Yeah.
And a lot of opportunities for several of the people that are on the line that have patents that may or may not even want to take their product to market. They want to sell their patents. So, all right. Mark Thorison, you are up from Inflatrix.
Come back. I'm here.
All right.
Here we go. I'm live.
Buddy. Here we go. I'm going to start the clock. You know the drill.
Clock. I know the drill. Yes, sir. Thank you, everyone, for coming. I'm Dr. Mark Thorson, retired general dentist, dental educator, dental innovator, and dental sales professional. Who's had a filling recently? Was it fun?
No.
Dental patients want three things. Please do a really good job. Please do it very efficiently. And please don't hurt me. The problem is that the current systems available for placing fillings in back teeth, which is where we're starting with ideal preps if possible, work. They do work. I've used them myself, but they're tedious. There are many parts to be handled, wrangled. Please don't drop this. You have to buy them, stock them, organize them. And the average clinician requires between 60 and 75 seconds to place just the hardware around the tooth before the new filling can go into place and keep its shape. That's the problem. I've lived this problem on both sides of the dental chair. It's there for sure. What's the solution? The solution is Inflatrix. Inflatrix goes into place efficiently between 10 and 30 seconds. It holds itself in place with air and water pressure, and it's comfortable for the patient. Those of you that are clinicians probably are aware, if you're not a laser doctor already, you might be. You have probably been pitched already. The reason I say it is because laser dentistry doesn't require shots. So the patients that are getting their fillings, cutting the teeth, aren't numb. Comfort is extremely important, especially with children. If you make mommy and daddy happy by not hurting little Jimmy, you're a big win. You're building trust between the doctors and patients. That's one of Inflatrix's primary goals. You can see water flowing through our one-way valve here, going into the device, holding itself in place. We are currently being evaluated by key opinion leaders in the clinical, industry, and academic sections of the dental world. We have 2 patents, we have a trademark, and the FDA says that Inflatrix is a 510K exempt device, which is awesome. By the way, my slide is a little old. We have 14 beta testers now, continuing to grow. Any clinicians out there, I would love to speak with you about adding to my list. We'll be selling directly to doctors on Inflatrix.com and in the show circuit. I have significant professional success in the show circuit. We'll be creating starter kits of 50, clinical kits of 300. We'll be building the device in 4 sizes to make sure we can cover the average variations in all permanent and primary molars to start, back teeth. Our market of all dentists, meaning GPs and kids dentists, that 80 million in the US, our SAM or beachhead market is those doctors under age 45 because they are most likely to be early adopters. The world market is double these figures. It's very attractive and it hasn't been disrupted for decades. Inflatrix will disrupt this market. My team, Frank, Andy, Eric, and myself have 120 years exactly of professional experience, expert experience in our various fields. We are the team to beat this problem. Our ask is $300,000. We will buy us workspace, up to 2 hires, the raw materials and equipment to build up to 2,000 units so we can make MVP by the end of Q4 this year and begin production in Q1 25. Therefore, Inflatrix will save time, money, and build trust. Trust is what brings patients, builds practices, and more confidence for the doctors and profitability. Thank you very much.
Perfect timing. Almost like you've done this before. Thank you, Dr. Mark Thorson. All right. Up next, we have BetterDiagnostics.ai.
All right, me.
Thanks, Rajiv.
Sure. Okay. So this is Rajiv. I'm the co-founder of the company.
Rajiv, why don't you put your slides in presentation mode if you can?
Yeah, sure. Systems, yeah, better.
Perfect.
Yeah, so thanks for the time. Essentially, my name is Rajiv Kumar. I'm the co-founder of the company. I've been working in IT, AI, and cloud from last 20 years. My wife is a dentist, so she presented the problem, and we started this company about 3 years back. The essential problem statement is to improve the AI user experience and affordability for the dentist. And the problem statement is some of the our competitors is to give you. So what we are doing is we are building a dental AI platform for radiograph analysis. Similar to Pearl and Overjet of the world. One of the issue that we have seen or spoken to multiple CEOs is affordability and the user experience being offered by the industry leaders. A solo dental office making $800,000-$900,000 after expenses, $300K take home. AI services are being offered around $500 to $600, which counts for about $7,000 to $8,000. But usually not affordable. Insurance doesn't pay for it. So that's how we started this company, with the idea that we want to empower our partners, which would be dental PMS and imaging firms, and provide accurate model at a very cost-effective price to improve the patient experience using including dentist and the patient. So our simple offerings are we do a revenue sharing models. Idea being that we share about 35 to 40% of the money that we charge to our PMS partners, and we use their sales support and marketing teams because they already have it. We want to focus solely on being a firm into dental and healthcare. Right. It enhances the service quality of the dental PMS, improves the diagnosis, right? Transparency to the patients, and affordability for small dental practices and DSOs. I'll just quickly move to the product roadmap. So essentially, we started in 2022. We launched in India. We got some feedback, and then we decided to focus on North American and European market. So far, we got Canada, Health Canada, and UK approval, and we have 3 models which are available for commercial consumption. So these approvals we got in last couple of months, and we got great interest from some of the dental PMS partners based on the offering. So IOP and OPG panoramic models, essentially we have about 20 AI models that we have built so far. And idea is once we settle down and we want to start work on CBCT and voice-based AI services. Again, offer the value add services in that area. We have submitted a FDA application, and we are working to address the review comments. Idea being by end of this year or Q1 we should have first FDA approval for, and that opens up US market for us. Competition, right? I'll just take this clinically. I wouldn't downplay any of my competitors. Everybody's doing things IOPA. For FDA US, ours is in progress. Some of the companies have already done it. For UK and Canada, we are at par. Some of the other companies...
Give you a couple more seconds here.
What is that?
I'll give you a couple more seconds. You're at 4 minutes there.
Oh, I'm already? Okay.
Wrap up and maybe get to the ask.
Yeah, so essentially this is me, my wife, and that's how you get the image. We provide image back to the dental PMS, and then essentially the dentist can use it. This is panoramic. We also have color imaging, which is essentially the product that we are offering for remote dentistry, teledentistry customers. And our ask is $500K for valuation of $5 million. That gives us 18 to 24 month leeway. Idea is to support our FDA approvals, build 3D models, etc. And we are looking just for about 1 to 2% market share in the US. That takes up to $5 million AR 2 to 3 years. That's it. Thank you so much.
All right. Thank you. All right. Next up, Dr. Joe Stavko from Easy Braces Brush. Thanks for joining us, Joe.
Yes, thank you. I just received my invitation a few hours ago, so
that's fun. You're here. All right, love it.
Yeah, so I have more of a story to tell rather than a PowerPoint presentation. And I'm an orthodontist, 25 years experience, and obviously decalcification is a huge problem around braces. And my toothbrush is the Easy Braces brush, and it is patented in the United States and Canada. I'm sorry, not Canada, Mexico. We did not do Canada. And I've been selling it for about 10 years online. I'm just a little independent guy. We started out selling singles, and it is, not a high profit margin, brush when you're selling singles. So we started going into multi-packs, 6-packs. And so just, was committed to trying to do this from the ground up. Being that it's a niche product, I've been speaking with as many people as possible in the industry, and they said, well, the big players are not interested unless they can sell 8 million units a year. And so it's a manual brush right now. So basically my goal is, from talking to lots of different hygienists and people in the industry, and I've never done a trade show, I haven't done a booth, that I should have an electric or sonic version, because people innately believe that there's some more value to something when you give it everything that you've got, with meaning that if it's electric or sonic, it's much more of a wow factor. And when the kids don't brush well, the parents kind of think it might be the brush rather than the kid. And so a lot of hygienists are, in my area will say, oh, well, go get a Sonicare. Surely, I lack the credibility that a Sonicare has, even though my design is basically like a film negative. There are 2 wells in the top of the toothbrush where the braces drop right into those wells. And the very first anatomy that's brushed are the gums and the decalcification areas. And so I have a reverse architecture that's built into the bristles, and the video kind of explains it much better than I can. But basically, traditional toothbrushes float on top of the heads of the braces. And that's why the kids can't reach their gums, can't reach the decalcification areas. And that's, the problem with why kids don't brush very well. So I'm looking, to take this to, there's a certain perception that among parents and hygienists that, oh, well, get the ultrasonic and get kind of maybe the most expensive product on the market. And then you can feel that you've tried your best to get your kids to brush better. And I have a busy orthodontic practice, 5 kids, and I've been hesitant to take my eye off the ball, which is my bread and butter is my orthodontic practice. And so I'm looking for people in the industry to try, take this to the next level with an either electronic or sonic version. I don't know if it needs to be rebranded, remarketed, renamed. Test Oral Health is my manufacturer, which has done hospital and cruise ship toothbrushes. It's kind of a minor brand that you may remember.
All right, Joe. So looking for advisors. Are you looking for investors as well?
I'm not opposed to it. I mean, yes, I think that if there's skin in the game, sure. I mean, I can probably fund it on my own, but I'm just, I don't have feet on the ground in the get it done side of the industry. And so my practice is supports my life. And I'm hesitant to spend too much time away from that. So yes.
All right, great. Well, let's connect, Joe, and getting you in touch with some of the right people to do that. Appreciate it, buddy.
Great,
all right,
thank you.
So up next, we have Kiddy Caps.
Hi, everyone. Just give me 1 second. I literally just decided to pitch. And I just finished putting together at least a couple of slides that I have a couple of visuals for you guys. Let me share my screen. So my name's Adrian.
Startup entrepreneurs, you got to be ready on the fly, right? Great.
My name's Adrian. I'm a product innovator. I usually work with climate and impact startups, but the company that I'm presenting today, I started together with my uncle, who's an engineer, and it's called, can you all see my screen?
Yep.
All right. Kiddy Caps is producing pediatric ceramic crowns that are affordable for all children. So really the mission that we're on is replacing stainless steel crowns entirely in pediatric dentistry. Really the kickoff point for this was they don't look exactly like this, but they have a little bit of a feeling like that. Some of the kids actually think it's cool to get silver crowns or to get stainless steel crowns, but there's a growing number of potential health hazards, excuse my German, depending on what you eat. There's a couple of psychological things that we're not sure of what they do. And just in general, ceramic seems to be performance-wise much better. So about 8 years ago, my uncle was at the dentist and saw a young girl, a 5-year-old, 6-year-old girl, looking like this, or very similar to this, and was really weirded out that he's looking at that. So inquired why that is that they're using these metal crowns. And really it came down to cost, right? So there is ceramic crowns for children. They're usually milled, which one has a couple of performance issues, but more importantly, it's just expensive to do. If you take a block of ceramic and then you mill out a single crown, that process takes time. That process creates waste, even though it can be recycled, but you need to go through quite a lot of steps to create these crowns. And then there's stainless steel crowns from big companies that are really cheap to produce. They're mass produced. That's why they can offer this price point. But a lot of parents are not able to afford the higher price point of the ceramics, which is something that we set out to change and create ceramic crowns that are affordable and come in at a price point that is comparable to these stainless steel crowns. So we're cutting the cost for pediatric ceramic crowns basically in half and are highly competitive with what 3M is mass producing from stainless steel. And we really think we have a shot to completely eradicate the need for stainless steel crowns in the first place and make that a thing of the past. So what we've created, this is patented. It took us about 7 years to develop an entirely new process and to get it all right and to really make sure that this is a high-end product and the price point works and then get it certified. So we produced the world's first injection molded zirconia ceramic crown for children, and we have a patent on the tooling, and currently we make them in Germany, and we can offer this price point of $10 while having incredible performance results. We did a test with the Technical University of Aachen. They found out that our crowns can withstand about seventh the biting force of an adult. So really, really powerful and amazing quality at a really low price point. The market is big. 1 of every 5 children needs dental decay treatment. Doesn't necessarily mean they need a crown, but they're on their way to potentially needing one. That's pretty much all I had time to slap together in the 5 minutes I was on this webinar.
All right. Well, we got another event coming up in a couple weeks. I just put the link in the chat there for those that want to attend or those that want to pitch. Now you know. Watch my LinkedIn because I've been promoting this for a couple weeks now. But happy to have you on, and I love that you did it. So let's keep going. Next up, Michael Negru. And I know Michael's prepared because Michael's a part of the client of the Dental Venture Capital Group and just an amazing guy, honestly. And he's a dentist up in Portland, Oregon. Really enjoyed working with him. Got really happy customers for this product. So I'm excited for Michael to pitch.
All right. Well, thank you, Travis. Thanks for inviting me. Let me, everybody sees the screen.
Yep.
All right. Let's see.
And your beautiful slides.
Oh, let's go back here to the beginning. So just want to talk a little bit about what, let me close this a little bit. Sorry, we're trying too many things in here. Hey, Travis, how do we get rid of this? There's just a bunch of windows here.
We see your slides perfectly for us. So just go ahead and go through the slides.
Okay, yeah. So, I was born and raised in Romania by parents that had to leave the country after, my dad's business was pretty much confiscated by the Communist Party. Immigrated from Romania with a family in 1984 and worked along my parents, a janitorial job all through high school. Went to college and graduated with double degree in biochemistry and biology at California State University while working full-time in genetics and some genetic analysis. I pursued a dental degree and graduated from Loma Linda University in 1996. I graduated and moved to Oregon right after graduation. Worked an associate for about 7 months, opened up a private office from scratch in Beaverton in 1997, owned from my uncle. Did all the tenant improvements with friends that were contractors and was able to do some trading and get things done. Invested in the real estate. I was a general contractor for several residential properties and entire subdivisions while running a dental practice and starting developing Envodent. So the reason I'm saying this is that we're looking for money, and you're not investing only in the amazing company that I think we're having, but you're investing in me, basically. So the problem that I've seen, I've used Inflatrix as my practice manager software for about 15 to 18 years in my practice. And there was a bunch of things that I found that there were some issues with the system. One, it's a very outdated system. There's no patient communication there. There's very cluttered user interfaces. And there's a lot more increased likelihood of errors with systems like Dentrix, EagleSoft, all the server-based systems. So the cost also, in order to have all of this fancy, SMS, communication, patient communication, texting, notifications, all of that stuff, we had to do a lot of add-on applications, and that add up pretty fast. Also, monthly cost, IT cost, hardware updates. I changed the servers probably, in my whole entire career, probably 4 or 5 times. And the computers, data backup costs, all of that add up. Another thing is when you hire a new staff, basically, it just became really hard. Even though they knew EagleSoft and they knew other softwares, it was always a learning curve to learn Dentrix, which we're on. So it was really difficult to get good, talented people and just put them on a different software, even though they had the experience. They had to start, where do I find this? Where do I find that? How do you do this? How do you do that? So I came with a solution about 10 years ago, put it on a piece of paper, and I said, well, we want to do something that's better. We want to do a all-in-one cloud-based practice management software. Little did I know what I was getting into. It was a long journey, but we're here. The U.S. market is a great opportunity. We have 158 general dentists and 23,000 dental specialists. Our solution is cost-effective, cloud-based, all-in-one, and we're going to be a disruptor in the whole practice management software. What we bring is an easy to use, clean UI, We save the time and money, easy patient communication, all-in-one integrated system, easy reporting and KPIs, compliant, HIPAA compliant, online form scheduling, efficient workflows, you name it, we got it all. So I think that key differentiator between us and a lot of the cloud-based, because I'm not only comparing to the server-based, I'm comparing to the cloud-based software solutions out there. We really have a really easy entry practice management software. I mean, a lot of the software, they're probably say, yes, we're easy, but we are really easy because we totally reinvented this dental practice management software. We deliver a comprehensive data migration from other practice compared to other practice management softwares. We have a lower cost compared to the other systems. They are similar. We have excellent customer support, and we have an integrated all-in-one modules that save time and the money. This is our team. Myself, Andor has been our developer, over 11 years of experience for huge companies like Google and medical companies, Comno and Smedics. Dia, which is one of our software engineers. Maris, which is in the implementation support, and then Dorina in operations with extremely quite a lot of experience. And recently we added Alan Sorelli, which comes from CareStack, and he's been with CareStack and Apterix. He's done sales and marketing. He was director of sales for CareStack, and he's just an amazing salesperson and person altogether. We have advisors, Travis. There's no need for introduction there. Dr. Ashley Ulmer, who was the former president of Washington Dental Association. And we have Paul Gilbertson, finance and banking for 25 years. Dr. Marilyn Sander, she's a private practice, and she's a founder of Good Checkup. Also a great software, mobile software. And then Matt Milligan, which is the dental set for Burkhardt Dental. So these are the revenue sources. We're monthly subscription at $3.99 per office, which is probably 30 to 40% less than a lot of the other software out there. One-time setup fee, $1,700. We have monthly revenue shares from partners like Soda Imaging and Dental Exchange, which we partner with, and 75 or plus per month or more, even to the merchant accounts, since we have incorporated Reg Pay with North American Bank. So what we're shooting for in 2025, we want to get to 120 practices. And by 2026, we want to get to 300 practices. How we're going to do this? We're going to have word of mouth referrals, organic growth, and growing pool of satisfied customers. Use dental social media to promote Envodent and by the dentist and the dental team members. We're going to go do trade shows, dental partnership with Burkhardt Dental and other suppliers. So yeah, Burkhardt is kind of one of our main dental suppliers that we're in discussions right now with and ready to close a sales and marketing contract with them. Dental consultants, and these are the funds that we're acquiring. $3 million to fund development, marketing, and sales to grow to $1 million in annual revenue by end of 2025, valuation between 6 and 10 million, and 4 million in annual revenue by end of next year, 2026 actually, and a valuation between 24 and 40 million. So how are we going to invest your money? We're going to use the first marketing. We're going to do a lot of website content, video testimonial from clients. We're going to do SEO, organic SEO to rank on Google for better visibility. We're going to do content marketing, blogs, video promos, pay-per-click, social media advertising, Google, Bing, all of those guys. Marketing automation and CRM tools, trade show setup and travel expenses, vendor revenue share from the initial onboarding fees and active subscriptions. As far as operations go, salespeople, we're going to pay the salaries and benefits package, the support team, the salaries and benefits package for those guys, implementation team, salaries and benefit packages, on-site training expenses like traveling, lodging, and meals, accounting and legal expenses. Development-wise, we need 2 more developers, engineers, just to increase the stability of the software and the testing part of it, and new features that we want to implement. So just to wrap it up, Envodent is raising $3 million over the next 160 days to fund the development, marketing, sales of our company, and hopefully here in about 1 million by 2025. We're pretty confident in that, and in annual revenue, and then by end of 2026, about 4 to exit to in 2026, 24 or 40 million, or stick with it and make more money. So this is my information here for anybody that's interested. I think it's a great opportunity for all of you that are listening. If there's any dentists out there This was founded by a dentist. I'm a dentist myself. So really, I want to give you that opportunity to invest because I think we're going to disrupt the market here. We're going to make a big change, huge change for the dental profession. And that's what I'm here for. That's what Envodent is here for, to make our lives easier.
Yeah.
Thank you, Travis.
Thank you, Michael. Yep, great job. And great product. Beautiful, fast. All right. So final pitch, Iris from Identical Implant. You are up. Good to see you.
Great. Thank you. Good to see you as well. I'll just share screen. All right. Hello, my name is Iris Wedeking, and I am the CEO and co-founder of Identical, where we are revolutionizing tooth replacement with our drill-free dental implants. As the wife of a dentist for over 20 years, I'm well aware that most people do not like going to the dentist. Furthermore, I know most people do not want a drill that looks like this heading towards their mouth. Unfortunately, as many of you probably know, this is the drill that's required today to replace a failed tooth with a dental implant. All implants in the market today are round titanium screws that require drilling a round hole into the jawbone to place the implant. This highly invasive procedure involves a 13% risk of causing nerve damage, takes almost a year to complete the full treatment with delayed placement, and requires specialized skills such as those of an oral surgeon to complete the treatment. The good news is we have a better way with the world's first drill-free, patient-specific 3D printed dental implants. Here's how our technology works. First, the dentist extracts the failed tooth. Next, the dentist scans the extracted tooth using any intraoral scanner on the market. They then send us that scan file, and then we use that scan to design and 3D print a customized dental implant that we then ship back to the dentist. And within 6 days of the extraction, any dentist with basic dental skills can simply press the implant right back into the native socket site where the original tooth was before. And it stays securely in place. We achieve primary stability due to the design features of our implant, which are patented. We have recently completed our first human clinical trial. We treated 12 subjects per our protocol and achieved a 100% implant success rate with 15 months of follow-up. We have a $13 billion global market opportunity. We plan to first pursue the US market and then EU, and then followed by that, we'll pursue the Asian Pacific and Latin American markets. We have significant benefits for both patients and for dentists. For patients, we provide a drill-free procedure, which involves reduced risk of causing nerve damage and also reduced fear and anxiety of the procedure. We have a 50% faster treatment time, so patients get their final tooth much faster, and increased access to treatment because any dentist in the world can easily provide this procedure with very limited training and no extra capital investment required. So we're ripe for mass patient adoption. In fact, we have a whole waiting list of patients who have contacted us through our website, waiting patiently for our implants to be available in the market. From the dentist perspective, we provide increased revenue for both GPs who are not placing implants today, as well as increased revenue for specialists who are already placing implants. We require minimal skills and training to adopt our technology, so any dentist can easily use identical implants, and minimal instruments and no inventory, so significant cost and time savings for dentists. As a result, we're ripe for mass dentist adoption. Our team has deep dental and medtech experience from leading companies such as Boston Scientific, Zimmer Biomet, and Dentsply Sirona. We are preparing to open a 15 million Series A round shortly. With these funds, we will get our CE mark and launch in the European market. We will complete our pivotal clinical study, which will allow us to get FDA 510(k) clearance and complete our innovation product pipeline development. Dental implants have largely been the same for the past 59 years. The dental implant market is ripe for disruption, and Identical is poised to lead the way. We invite you to join us on our exciting journey ahead. Thank you so much.
All right. Thank you, Iris. All right. I think that wraps up the pitches for the day. Appreciate everybody that has attended. Our next event will be on September 8th. If you want to keep in touch with us or learn more about upcoming events, go to dentalvc.org. And with that, I will close out this event.